Okay, well, thank you for your patience, both the in-person attendees and for our online folks who I hope can hear me now that the mic is on. We have an extremely packed event today, and we've just been waiting for folks to come in. But I am happy to welcome you here today. My name is Gwen Driscoll. I am the Director of Communications here at the UCLA Center for Health Policy Research. It's our pleasure to welcome you once again to our 2015 Health Policy Seminar Series and to this exciting launch of new CHIS data from 2013 and 2014. Okay, just before we begin, however, I just want you to please save the date for our next seminar. On September 22nd, Center researcher Catherine Keatsman and Dr. O. Kenrick Duru from the David Geffen School of Medicine at UCLA will present early findings from a new project to increase the use of clinical preventive services such as flu shots or mammograms among older residents of South Los Angeles. This is an innovative, interdisciplinary team of UCLA researchers, community groups and health centers, the LA Department of Public Health, local aging resources and women's groups, and others, and is part of a larger trend to provide preventative care now rather than costly emergency care later. So please join us, save your date, September 22nd. Okay. As for today's seminar, we will be recording it as always, and it will be placed on our website at the address you see at the top of this slide. If you are subscribed to our e-newsletter, Health Policy News, you will also get an alert that the video is up and available to be seen. And just please note, we will have a brief Q&A session at the end of this presentation. So if you can save your questions till then, that would be great. Okay, I am now happy to introduce the co-presenters of today's seminar and the people who are responsible for making your phone ring and the phones of tens of thousands of other Californians ring over the past 10 years and beyond, Dr. Ninez Ponce and Dr. David Grant. Dr. Ponce is the principal investigator of the California Health Interview Survey, or CHIS, and a professor in the UCLA Fielding School of Public Health. She is also associate director of the UCLA Center for Health Policy Research, and she is a noted expert on multicultural survey-based research. Specifically, Ninez has been a leader in making surveys, and particularly CHIS, more representative of the increasingly diverse nation that we live in. Starting with the first CHIS survey in 2001, which she helped develop, Ninez has pioneered new measures of racial and ethnic identity, acculturation, generational status, and discrimination. With CHIS, she devised the rationale and implementation of Asian ethnic oversamples, and the cultural and linguistic adaptation of the survey in Chinese, both Cantonese and Mandarin, Korean, Vietnamese, and Tagalog. Today, CHIS is a survey that is recognized and used nationally and internationally for its rich sample of many undersurveyed ethnic, racial, and sexual minority groups. And this is in no small part due to Ninez's efforts. Dr. Grant is the director of CHIS and a sociologist who has managed surveys of significant size and scope for the Los Angeles County Metropolitan Transportation Authority, as well as for the UCLA Center for the Study of Urban Poverty. Now, in his 9th year as the director of the CHIS survey, and actually he's been at the center for longer than that, David has overseen numerous innovations to CHIS, including expanded efforts to ensure data quality, new web tools to make data available at the zip code, city, and legislative district level. And now with this latest release of CHIS 2013 and 2014 data, the release of timely one-year data sets, and they will talk more about this in their presentation. Both David and Ninez care passionately about what the CHIS survey means. Comprehensive, evidence-based information that can be broadly disseminated to create lasting change for the better in the lives of all Californians. So please help me welcome Drs. Ninez Ponce and David Grant.
Thank you. Thanks so much, Gwen. I'm going to start. I'm Ninez, I'm not David, and then I will hand it off to David. Hello and welcome. Welcome to all of you here, and welcome to those of you on the phone and on the webinar today. A special thank you to those of you who were gracious and kind enough to answer the phone and answer the survey. Thank you if you were the randomly chosen person or household that we picked. So today, we're going to give a brief overview of CHIS. I know many of you have used CHIS, have supported CHIS, are familiar with CHIS, but it's always good to get a sense of the principles of CHIS since its very founding. We're also going to review the exciting products that we're releasing today, and then what's new with the survey. We've been conducting this survey since 2001, and each cycle we've had innovations, and so that we'll focus on today. And then some examples of some of the CHIS data estimates will be provided. David Grant will also show a demonstration of AskCHIS, which especially the feature of pooling data across several years, which is another new innovation, and then we'll end with questions and answers. California Health Interview Survey, or CHIS, is large, and it has to be large because we want to make estimates for counties in California. It is geographically stratified, and it's a random digit dial telephone survey. We've been surveying both in landline and telephone. In the last CHIS cycle, it's 20% cell phone and 80% landline. It's conducted in every county and represents California's diverse population. It's a survey not just of adults, but a survey of teens and children in California. To capture the diversity, the linguistic diversity of California, we conduct the interviews in English, Spanish, Cantonese, Mandarin, Korean, Tagalog, and Vietnamese. Since its very founding with Professor E. Richard Brown, the founding principal investigator of CHIS, the principles of CHIS were that it would be designed from the ground up, and it would be designed from the ground up with multiple constituencies, and that the data would also be fresh to be used. It would support decision-making at the local level and statewide in public health and in healthcare. And it would also be designed to measure the health needs of various socioeconomic, racial, ethnic groups to detect where there might be any inequities in the use of healthcare or in access to it. I want to thank the 2013-2014 sponsors that made the CHIS data collection possible. The public agencies include the California Department of Public Health, the California Department of Healthcare Services, First Five California, the California Department of Healthcare Services Mental Health Services Division, the California Health Benefit Exchange, Recovered California, San Diego and Sonoma counties for their oversamples, and the UC San Diego California Tobacco Control Program. We're also supported by private organizations, the California Endowment, which has supported us from almost actually even before the beginning of CHIS, even in thinking about can we make CHIS happen. Kaiser Permanente, which has been a constant companion for several cycles of CHIS data. The California Healthcare Foundation, which has supported us greatly in the 2013-2014 data collection. The Public Health Institute through a CDC Community Transformation Grant, and the Carrier Senior Healthcare. Clearly, we have broad-based support publicly and privately. So I'm going to turn this now to talk about the nitty-gritty about the methods of CHIS. So I'd like to call Dr. David Grant.
Great, thank you, Dr. Ponce. So I'm going to talk a little bit about how CHIS is done. And from a methodological perspective, CHIS continues its long history as a large, geographically stratified, random digit dial telephone survey. We conceive each cycle as a 2-year cycle, and each 2-year cycle is designed to produce statistically reliable estimates at 2 levels. One, for counties, and secondly, for the state's major racial and ethnic groups, as well as many racial and ethnic subgroups as well. So in terms of the geographic stratification, we've used essentially the same geographic design since 2005. It includes 56 geographically defined strata. 2 of those include sub-county areas. Those are for the 2 largest counties in the state, Los Angeles and San Diego. There are 39 individual counties that serve as sampling strata, and then the 17 smallest counties by population are combined into 3 multi-county strata. We run a dual frame sample, so there's a separate cell phone sample since 2007 and a landline sample. We do some some ethnic oversamples as well, and we've oversampled a lot of different groups over time, but the 2 consistent groups that continue in the 13-14 cycle are Koreans and Vietnamese. We do both some geographic targeting and some surname list sample to bring those up to about 500 households for each of those groups. And then we do some geographic oversampling of counties with some county partnerships, and we'll talk about that more in a little bit. After we call a household, we select 1 adult at random from all the adults in a household, and we also include a child and teen interview as well if they are also in the household. So in each household that participates in CHIS, we may complete as many as 3 interviews. An adult interview that's about 30 to 35 minutes long, an adolescent interview, and our adolescent sample is age 12 to 17. That interview is completed directly with the adolescent after obtaining the parent's permission. And then a child interview, about 15 minutes in length, and that is done by proxy with the adult most knowledgeable about the selected child's health. CHIS 2013-2014 is our 7th completed cycle. We are now in the field with our 8th cycle, CHIS 2015-2016. And at the bottom of the table here, you see the sample size by age group over time. So in terms of some of the more details about the specific cycle that we're releasing today, data collection for 13-14 started in February of 2013 and ended early in January 2015. In our continuous data collection model, we're collecting data continuously and at a fairly even pace throughout the year, so that about half the data were collected in 2013 and the other half in 2014. About 20% of the interviews originate from the cell phone sample and about 80% from the landline. There is a lot more detail on the CHIS sampling methods, the design, the weighting and variance estimation procedures on the CHIS website. And there are 5 series methodology reports. Not all of those are up yet for 13-14. Those trickle on as they become available. Check back frequently as those become available. We're also releasing today a new short document titled What's New in the CHIS in the 2013-2014 California Health Interview Survey. That highlights both innovative and new elements in the design as well as survey content in this cycle. And we also have a forthcoming document. It's will be hot off the press shortly. We were working on it this morning on pooling 1-year public use files that we think will be useful for our users moving forward. In terms of what we're actually releasing today, or as of this morning, there are 6 new public use files available for download at no cost through the CHIS website. There are 3 2013 files, separate files for the adult, teen, and child. And similarly for 2014, there are adult, teen, and child data files available. Those are in multiple formats, so whether you're a SAS, an SPSS, or a STATA user, you are in luck. And then in terms of Ask CHIS, our wonderful query system, we released 12 new data files as of this morning. So there are now separate files for adults, teen, and child for each of the 4 past data collection cycles, 2011, 2012, 2013, and 2014. We're now going to kind of move to what's new in terms of our release and our products. And the most innovative piece of our release this year, this cycle, is 1-year data files. So In all previous cycles, data was released as a 2-year cycle. So the previous cycle, 2011, 2012, was a combined file. We're now releasing separate files for 2013 and 2014. The reason to do this is to provide the most timely information available on the health of Californians. And moving forward, we anticipate an annual release of data. So this time next year, 2015 will be available. The year after that, 2016 will be available, et cetera. And that means that through AskCHIS and our public use files, you should have access to data 6 to 8 months as soon as that cycle is complete. So much more timely data, and we're really excited about that. We will also re-release the 2011 and 2012 data as single-use or single-year data files later this fall. AskCHIS, as we've already mentioned, already includes those separate years. And AskCHIS Neighborhood Edition, our newest health tool that releases or provides estimates at the zip code and city and legislative district levels, which currently is displaying 2011-2012 data. We now that the 13-14 data is available, our team are using those data to update those estimates. That's a fairly lengthy procedure with a lot of calibration work, and those new estimates for 13-14 will be released in early 2016 on AskCHIS Neighborhood Edition. And then finally, one note of caution on the 1-year data files, as I think Ninez and I have been probably very cognizant of CHIS designed originally as a 2-year cycle, and our sampling goals and objectives are over that 2-year period. We're releasing 1-year data to make it more available and make timely data available for California. But 1-year data at times may stretch our goals, and it may mean that you often need to combine more than 1 year of data to create a stable estimate. And that becomes particularly true when you start to go into some of the smaller population groups like the child sample or the teen sample or some of the ethnic and racial groups and sub-ethnic groups. So that's just a note of caution. It's also why we're working to provide you with some updated information on how to combine public use files. Also, what's new? As many of you know, we have a new Affordable Care Act that was fully implemented as of 2014. One of the new features of that is the Modified Adjusted Gross Income, or MAGI, eligibility criteria. So starting in 2014, we have new variables on MAGI eligibility for the Medicaid program here in California, Medi-Cal. We have several new survey content areas for the 13-14 cycle. There are new questions on contraception use, access to general and specialty care, industry and occupation, variables and content we had in past CHIS cycles that we haven't had for about 5 years. So that's exciting and new and important for some of the coverage issues that the state is exploring. Those indicators are not currently in the public use files, but we will release those in the upcoming months. We also have some new indicators on teen and child sedentary behavior and teen leadership. And then as the Affordable Care Act and the health insurance market in California has changed, the survey needs to be responsive to those changes. So starting in 2014, we added a lot of new content in order to pick up Californians who are enrolling for coverage through Covered California. And so there are a lot of new questions both about enrollment in Covered California as well as the experience of shopping in the individual market. And those variables are, many of them, available in the public use files as well as on AskCHIS. And we're going to continue, and I'm going to turn it back to Ninez to continue the what's new.
Thanks, David. Before I do that, I might break tradition, Gwen, by trying to answer this question now. Is that okay? There is a question posted by Gail Brandt on why the big drop in sample size from 2001 and 2003. I think this is based on the slide that David showed on the different sample sizes through the years. And it's highly correlated with the slide I showed on the sponsorship for CHIS. So it is about cost of the sample, and that is also related to the effort it takes for responses to go up. And so the vagaries or the variances that you see cycle by cycle are a function of the sponsorship. And from 2001 to 2003, my recollection, David, is that there was a big funder that stepped out in 2003 that we were able to get back. So that's one of the big explanations. So what else is new? And I'm as nervous today as my first child, but very giddy about it, because this is the first time, and I see the team members here, that we are releasing so many different products in one day, so many different products. And so the geographic oversamples are very important. And I like this slide because it shows we are still on mission. We innovate, but we're on mission in the principles of CHIS, which is to provide estimates as best as possible to local areas, particularly counties, and to provide diverse linguistic and racially ethnic data sets that represents the population. And so for 2013-2014, we have new geographic oversamples from Sonoma County, and also from a 3-county CDC transformation grant with Public Health Institute, Calaveras, Siskiyou, Tuolumne, my favorite county, 400 households each. And San Diego County is here. It's not new, but we thank San Diego County because they have been funding an oversample since 2005. Ethnic oversamples. We've been oversampling Koreans and Vietnamese since CHIS inception. What's new this year is that we have a Japanese American oversample, about 130 additional households, boosting the entire Japanese sample for 2013-2014 to over 500. And this is supported by Kairos Senior Healthcare. What's also new is beginning in 2014, based on our analysis of the 2010 census data on the most spoken languages here in our great state of California, as well as looking at those who are linguistically isolated. That means someone in the household cannot speak English. To improve coverage, we added another language. So in addition to English, Spanish, Cantonese, Mandarin, Vietnamese, and Korean, we started conducting in Tagalog. Mabuhay, as my compatriots would say. So I want to emphasize that we're producers of data. I'm a researcher, but my role here is I'm a producer of data. And this data is so new that I haven't had time to completely look at everything about all the different indicators. So it's so new to us, and it is an invitation for each and every one of you here on the phone in California and the rest of the nation to look at the CHIS data. So these are just some snippets of our data estimates. So one of them is children and sedentary time. This question has been off and on in CHIS, but it has made a comeback this year, again with this interest in the growing obesity problem in our state and in the nation. The sedentary time question is on a typical weekday. Nearly half of our kids in California, ages 2 to 11, spend 2 or more hours a day in sedentary time. And this is measured as watching TV, playing computer games, or talking with friends. But what astounded me here, what surprised me, was on the weekend that sedentary time increases to 7 in 10 kids. So we're not having outside activity as much as we are with kids on the weekend. For teens and smoking, again, this is a very hot topic right now, the vaping. And roughly 1 in 10 teens reported vaping or smoking e-cigarettes. This is a new question in CHIS 2014. We introduced it in 2014. We don't have trends, but for example, we've been asking about teen smoking since 2001, and that smoking rate is low. I'm going to look at my my CHIS team, it's less than 2%. It's around 2% for smoking. But for vaping, for teens, 1 in 10%. This is also alarming based on a new study that just came out today in JAMA that shows some evidence that vaping is a gateway to smoking, so versus a substitute. High school students and community, this is very heartening. Nearly 90% of teens feel they can make a difference, in their community. A positive attitude that was about the same as 89, 90%, 91%, very compact distribution across different racial and ethnic groups. And then, I think many of you are waiting for this. An example of annual trending is that the health insurance coverage. So now that we can release data each year, and this happens to be a milestone 2-year period, 2013 and 2014 with the ACA, we're able to look at trends between 2013 and 2014. With the implementation, although it actually was implemented before 2014, but in terms of the coverage expansions, in terms of the Medi-Cal expansion and Covered California, this occurred in 2014. It mostly impacted adults through the expansion of Medi-Cal, particularly for single childless adults, and for Covered California to purchase privately. We have a fact sheet that goes more into detail, but what I wanted to show is now with the data we can do a trend analysis, and we focus on the 19 to 64 adult age group. This is a figure from the fact sheet that's released today by Dr. Sheena Alex Lavaredas, is the author. And I point you to what I circled in red, which are the significant trends from what we see, not just from 2013, 2014, but also how we've been tracking it back since 2011. And in 2014, we see a decline in the uninsured rate from 20.6% to 17.4%. Again, this is adults, 19 to 64. That downward trend was significant. Prior to that, the uninsured rate had been fairly flat. This was driven largely by the Medi-Cal coverage increase between 2013 and 2014 from 12.9% to 19.2%. Employer-sponsored insurance is flat through these years, and the other public goes down significantly, and privately purchased goes up, but not significantly. So those are a few tidbits. I'm sure there are many questions. Let me just take a look. I see there might be already questions here. But before I take that, I'm going to give time to think through those questions. And it's an opportune time then for David Grant, Dr. Grant, to come back and do an Ask CHIS demonstration.
So, and I'm working with my colleague here, Rick, to change the screen so we can get Ask CHIS up on the screen in front of you. I do want to remind folks, if they aren't available or aren't aware, we have these pens that are nice and work just fine, but they have a cool feature that's often kind of stealth, that they have this little scrolling feature. And so I'm going to demonstrate something on Ask CHIS today, and we like to say our query system is so simple, we put the instructions on a pen. And it's true, they fit right here on a pen. So without further ado, I'm going to log in here to Ask CHIS. Ask CHIS has been available since 2000. I'm not sure I can do that, Rick. Is that?
I got it. No, I think we're going to have to open on yours.
Let me see. Okay. take a moment here. I can't quite see it. Does anybody else see this? Oh, okay.
Now everybody knows.
Yeah, now everybody knows my login. So with the one-year data, we've added some new features to ask CHIS to make pooling years easier to do and provide more flexibility to our users in terms of how they structure a query. And earlier today, I said, you know, we need to keep in mind that CHIS is designed as a 2-year cycle to achieve our sampling objectives, and that you may have to pool the 1-year data file. So just to give you an example of stretching the data beyond its limits, I'm going to
It's not being shared.
oh, it's not being shared.
You gotta,
Beautiful. Great, thanks, Rick. Okay, I'm going to conduct a query that stretches the data beyond its limits, and then show us how we can recover from that. So the first step in AskCHIS is to select a geographic area. You can select the entire state as the default. Got some box here. Oh, man. Confound it. I think I can do it here too. I'm just going to go up. And I'm going to select a topic. So I've first selected a geographic area of Los Angeles County. I'm going to select an indicator that's asked as part of our child survey, and it's about parents and their children interacting. And the question that I'm going to select is one about how often a parent reads with their child, the frequency that they read with their child. And so I'm stretching the data in a couple ways here. First, we have data statewide. I'm only taking a single county. It's a pretty big county, Los Angeles, but I'm still taking a subset of the state data. And then I'm taking an indicator from the child survey, and as I mentioned earlier, our child sample is 0 to 11. This is only asked of the 0 to 5, the youngest children in California. So we're stretching the data pretty thin here, and when we do that, when we go ahead and get our estimate, we might have some difficulties, but let's take a look. So we have 66% of children who are read to every day, about 22.5, 3 to 6 days a week, and then 1 to 2 days a week, 7%, and 4.5% never. And as you'll notice, those last two indicators here, the last two rows, have the dreaded red asterisk, which as we go down says that those are statistically unstable. So it's also telling me that I'm only using the 2014 data at the bottom of the table, and our default is always to provide you in AskCHIS with the most recent data. So what I can do is here, I can go into time period, and I can select a single year. I can compare years, but my strategy for providing stable estimates is to pool years. And now I see all the CHIS cycles displayed here, and I can go through and I can select 2013, 2014. I could take more. You'll notice it won't allow me to select 2009 or earlier cycles. And that's because there are some differences in the weighting procedures between the data that was from the prior decade, all weighted to Census 2000, and the current data, which is all weighted to Census 2010. So I can select multiple years, which was not previously available. I can select now that pooled estimate for 3 independent years, get a result back, and lo and behold, it has stabilized those rows so that now we see in the 1 to 2 days a week, it's 10% and never 6%. So just a quick example of Ask CHIS, how it can be used and how its features have been enhanced to allow greater use with the 1-year data. So that was just a quick and easy. I'm going to go back to Dr. Ponce. And Rick, we get back to the presentation. I think I can do that here. So,
Stop sharing.
okay.
And there's the share my screen to drop down. Recently shared. Excellent.
And we're back.
That's good.
Amazing.
Thanks, David. We're back actually to thank the CHIS team and then to open up for questions. Many of the team members here, heartfelt thanks for all the work you've been doing for the last 6 months. And this to Tara, to Carlo, Akbar, Rick, helping us with the webinar, Marisol, Carl, Patricia is here. Patricia, thank you. Holly, Matt, Jane, Karen, Royce, Priya, Diem, Byron, Bogdan, Pan, Yuyan, Kelly, and Hong Jin Yu, Dr. Hong Jin Yu, who is the director of the statistical unit for the center and also is the mastermind with a lot of the statistical quality control that we have here for CHIS. So thank you very much, and we will go with the, oops, I can't move it anymore. I guess it's the Q and
Click on the arrow down at the bottom.
the next slide, visualize. Thank you, and we're open for questions and answers. David, why don't you come up here with me so we can answer this in tandem. And let's take a look at some of the, or let's have Gwen, are you going to referee and ask us, or
Yes,
should we
I am.
just read it? Okay.
So I'm getting a lot of questions on specific indicators. I think we should just reiterate the fact that we have not parsed all 8 billion responses and questions in the survey. And neither Ninez nor David can provide an authoritative explanation as to why things have changed or not changed. So we'll ask some questions, and then if folks have further questions, they can always email me and I can pass it around to our subject area experts and see what they have to say. It will be forthcoming research in the next months using this data that might answer some of your questions. So,
They can't hear you well, Gwen.
so do you want to reiterate?
Yeah, I'll reiterate. Gwen said that David and I cannot answer or speculate at every single one of the, she said billions of indicators in CHIS, but it was exaggerated. But we again, we invite researchers to look at the data, particularly those with content expertise. We'll try our best in conveying measurement, specific measurement issues, or when comparison to which to previous CHIS cycles. But anyway, we'll do our best.
So a lot of these questions are about specific topics.
Do you need a mic, Gwen? They can't hear you.
I'll
repeat it. Okay.
Reiterate.
Okay.
We had a question about how gender identity is constructed within the survey. I think that was tackled by Gary in June, so maybe and I've referred people to that online, and maybe you can talk a little bit about that.
Okay, so I'm going to give that to David Grant. Sure.
So CHIS since 2001 has included questions on sexual orientation. All the way up through the current cycle, we're asking questions about sexual orientation. Starting in 2005, we all added questions on sexual behaviors as well. So how many partners, the gender of your sexual partners as well. And then we're very pleased that in 2015, with the collaboration between our center and the UCLA Williams Institute, we added questions on gender identity. We pilot tested 4 different gender identity questions in the last quarter of 2014. We did a lot of analysis of those data and monitored and added 2 new questions in 2015 to our statewide sample to measure gender identity. Now, we don't expect that we'll have enough, talk about stretching the data beyond its limits. We don't think we'll have enough responses in 1 year to actually make those data public or report them, but we do anticipate that over 2 and maybe even 3 years, we will have some very interesting and novel data on gender identity among adults in California. So we don't have it in the current data that we're releasing today, but we are measuring it now. I think we are one of, if not the first, large probability-based health survey to include questions on gender identity.
Massachusetts BIRFIS does, but the sample isn't as large as ours. And again, we thank the Williams Institute, and that's a stay tuned for forthcoming CHIS.
Is there a question in the room?
Paul.
Yeah, I was wondering, you mentioned that there's some new data like on contraceptive use. Some of that has not been publicly released, one has to go through a process to obtain it. I was just wondering, are there any changes in that, what data is now open to the public, which you have to access by, making a specific request?
I can start, and then I have David fill in the details.
Could you reiterate the question?
Oh, I'm sorry. Dr. Tavro's question was about the access to some of the contraception questions in CHIS and policies on why some might be available and why some might not be available. There are some indicators in CHIS that are not publicly available due to the sensitivity of the questions and due to small sample size. So it's the protection of the confidentiality. So it's for confidentiality purposes. And there are some indicators that are not live today simply because they're not quite ready today. So for example, the industry and occupation in terms of the coding of that is not quite ready today. For the contraception questions, I'm going to give it to the specifics on the status of that. I'm going to give it to David Grant.
Yeah, and I'm not 100% sure either. Many of those new questions on contraception are in the adolescent sample, I believe. Is that true? And the sample there is quite small in some cases. We often, if they're not in the public use files, we often can make them available in Ask CHIS because Ask CHIS, unlike the public use files, provides only weighted estimates, they're rounded estimates, and so it has some built-in features to protect confidentiality. Nonetheless, all the data are essentially available to researchers. It may require going through our Data Access Center, which is led by Carlo Carino here and Holly Riha. And all the information is online, and we're happy to work with researchers and do every day to provide access to those sensitive data elements.
Just a quick question. Is vaping in the, I know it's on Ask CHIS, but is it in the PUF files? I presume it's in the PUF files.
I don't know if it's in the 1-year public use file. I don't think so. To reiterate. So the question was, is the e-cigarette, the vaping question, in the public use file? It's not.
Yeah, we got confirmation
but
it's not. Yeah.
The teen is available on Ask CHIS right now.
Just related to what you're talking about, someone's asking, can you please review when specific data categories will be released? Is there any way to talk about that?
So the question is, when can specific data
What does data categories mean?
categories?
There seemed to be some confusion, I think, in the questions that we're not releasing all of our data. And because of this specific
Right.
issue. So maybe you could clarify why a few questions are not in the public use file now.
Sure. So we're releasing public use files and we're releasing data on AskCHIS. The public use files go through a review process to identify variables that have small samples or are very sensitive in terms of the nature of the content. For example, mental health treatment. Questions that, or estimates, variables that have those small samples or are sensitive are suppressed and not included in the public use files. However, the number of questions that are suppressed is very small. Most of the data is available. I look through our questionnaires, the 2013, 2014, as well as all previous questionnaires are available through the CHIS website, and you can see the exact question wording and explore those variables. Ask CHIS, we have currently about 170 variables from 2013 and 170 variables from 2014. Those are the most popular and trendable variables. We continue to add more content and questions to Ask CHIS moving forward. But most of the data that we can release, we have released.
I think it's also important to note that the public use files do not give geographic identifiers, so you can't at the county. So it's used for statewide estimates. And if you wanted to look at a specific county estimate, you couldn't do that with the public use file. You can with AskCHIS, but you can't with the public use file. Just because the location in combination with, even if a topic is deemed not sensitive and therefore isn't a public use file, but if you start looking at Native Hawaiians in Alpine County and vaping, then it's with 1,000 people in Alpine, and I'm not even sure if there are any Native Hawaiians, but there's then you start getting into breaching confidentiality.
For a question in the room? I'm glad to see that Kaiser Permanente is among your sponsors. I'm curious, Kaiser has created a platform which I think is for hospitals, the Community Commons platform, which pulls mostly from the community surveys, the census surveys. Will there now be greater interoperability with the CHIS data? Because that's such an incredible resource for the hospitals who are doing those mandated needs assessments.
Our funder for Kaiser Permanente, I'm sorry. The question was from our audience, was that she's very glad that Kaiser is funding CHIS and Kaiser has a community commons platform, and are there plans for interoperability with that platform and CHIS, not just CHIS data, but we also have Ask CHIS Neighborhood Edition and Ask CHIS. And the good news is that the funders for us, which is the Community Benefits Program, are the same people as the Community Commons. So that will have to be a plan for the future, but we thank you for raising that.
Questions up front here?
Yeah, I was just, so similarly, as someone who works a lot with cities, can you speak to maybe some of the challenges, if there are any, in terms of organizing the data by city? Yeah, that's basically it.
So I'm going to speak as a researcher now. You would have to get, I would suggest that your project should go through Data Access Center, because you're getting the localities that are sub-county level and sub-state level. Even counties, you still have to go to the Data Access Center. So if your interest is in looking at regression models or doing more complex models, then looking at the tools like Ask CHIS, which actually is at the county level, not the city, then it would be the Data Access Center file. Now, if you want to look at trends of indicators, we do have Ask CHIS Neighborhood Edition, which the lowest geography is the zip code. and you can aggregate the zip codes to cities, and then you can make some comparisons. So it would be more of a snapshot comparison of about 20 health indicators and some socio-demographic indicators from the American Community Survey that would give you a quick look.
I had a quick question about the adult physical activity indicator and its absence in the most recent data set, and if there was a rationale for that. And also sort of just in more broadly the continuity of certain types of indicators over time. You know, if we want to make a longitudinal statement, it's really difficult to do that when an indicator like that sort of drops off. And so I guess I'm interested in the rationale or thinking behind that.
So the question is the absence of a physical activity measure in 2013, 2014, and the difficulty for establishing trends or doing longitudinal analysis when the survey content continually changes. So there are some questions on physical activity for adults in 2013, 2014. I believe we're back to the walking questions in 13, 14. We have kind of gone back and forth between walking questions and moderate and physical activity questions. And it's always a balance in trying to make sure that we're including some content to address a broad range of health behaviors in California. Some of these changes are in the interest of public health. Some of them are because our funders are interested in funding something new or something different. Overall, I'd say 80 to 85% of the content carries over from cycle to cycle, but there are some differences. And the health behaviors section tends to be the one that has the most variability cycle to cycle. So a lot of the questions on diet, a lot of the questions on physical activity kind of come and go over time. We do think that with one-year data files and multiple cycles of CHIS data, you're able to kind of find similar indicators over time and do some either pooling or trend analysis. But I understand the difficulty.
Okay, just because we want to, as our speakers have to move on to other meetings, I want to keep this quite compact. I think this is a good way to wrap it up. But again, you should see my email up there. If you have questions that you really want answered, please email me and I will definitely follow up. We have a question from someone about, can you give a brief overview of the process of using the DAC, the Data Access Center? And for example, is there a way to estimate how long it would take to run X lines of code or that kind of thing? But maybe talk about what the DAC
Yeah, we have a lot of information and even cost information about the DAC services available online, and the applications are all PDF forms. It's really easy, and we also have people behind us that can help answer your questions. So if you're confused, if you're not sure where to go to the CHIS website, look at the feedback button, give us a call. We have a toll-free line. We have an open email address. If you can't find what you're looking for, contact us and we're happy to help you.
But perhaps you could give just an overview of what the DAC is and what it can do.
Sure. So the Data Access Center contains all of the CHIS data, all the confidential files, as well as the public use data and the geographic indicators. And we have geographic indicators right down to the latitude and longitude of the household. So if you're interested in, such as Dr. Ying Meng here has done a lot of work looking at environmental exposure data and how asthma, uncontrolled asthma, is related to ozone exposure. We can link Air Resource Board data to the CHIS data using that geographic latitude and longitude. And the folks in our Data Access Center maintain all that confidential data in a segregated network that is not facing the internet. It's a private segregated network, so we're able to do confidential data analysis in that area. Those projects go through a review process, so you have to apply to use the DAC. Again, it's easy, and we're here to help you do that. And that will allow you to run all kinds of sensitive, confidential, or geographically very specific analysis in the secure confines of our Data Access Center, which prevents us from leaking any respondent confidentiality out into the wild, so to speak. So we're happy to do that.
I one final question, because we need it for the camera. Can you just describe briefly what kind of health conditions generally that CHIS surveys about? Diseases?
The question was, what kind of health conditions does CHIS ask about? So first of all, CHIS is a population-based survey, and it really shouldn't be used, say, for looking at cancer prevalence. But we do ask about, we've asked in the past and through the years, we've asked about asthma, cancer, hypertension, heart disease. There was one year we did, one or two years we did epilepsy, diabetes, we've always been asking.
Arthritis,
Stroke. So a lot of these chronic conditions we do ask about. Oh, thank you. So we have some mental and dental health.
Okay, great. All right, well, I want to thank you very much. Can we give a nice round of applause?